Hi, my name is Rachel Kapler, and I'll be doing a Healthy Community Brookfield Situational Analysis. And I am the new Chief Executive Director. My audience is the Board of Directors. And the goals of this is to present a situational analysis of Healthy Community Brookfield's current state. So the history and overview of Brookfield. So Healthy Community Brookfield began as a visiting nurse agency known as Brookfield Health. It is a non-for-profit organization and was established in 1998 after receiving a grant. Many programs have arisen from Healthy Community Brookfield. There's no current strategic planning process or expectations that have been formed, and the community of Brookfield is approximately 85,000 people, consisting of mostly rural farmers, and Healthy Community Brookfield organization has 97 diverse employees. We do have a board of directors, and they are in charge of overseeing program progress, staff core functions, and the organizational success. So the programs and services offered by Healthy Community Brookfield. There are many promotion and wellness programs, including primary care and women's health services through mobile health vans and outreach, prenatal and newborn care, violence prevention programs, education on diabetic care, well water testing program and mitigation, case management for the elderly, occupational health and wellness, smoking cessation classes, after-school programs for teenagers as well as school health, wellness and fitness programs, and immunizations. And it's important to state that Healthy Community Brookfield used to have many more programs, but they've been cut due to funding issues. And those included teen nutrition education, babysitting classes, bereavement services, and caregiver support groups. So there are many environmental factors that affect the current state of Healthy Community Brookfield. These include the community expectations and relationships. The relationships are strained. There are community members that are providing pushback on funding, local leadership, and coalitions and programs that are already in place. Community services that are already established throughout the community include Meals on Wheels, the YMCA/YWCA, Elder Services, and the United Way Foundation. The external factors and the macro environmental forces. These are the driving things that affect Healthy Community Brookfield overall. These include ethical factors. Healthy Community Brookfield needs to ensure ethical principle values when providing patient care and recognize community values that may impact program success. Economic forces. Recognition of the decreased public health funds that have continued to dwindle over the years will cause diligent planning processes for budget funding, as well as finding sustainable solutions to decrease reliance on public and federal funds for programs. There is a current financial instability at Healthy Community Brookfield. Politics. National and local leadership in the allotment of funding. This affects the provision for programs at Healthy Community Brookfield. Cultural and societal components. Brookfield has many cultural and societal components to receiving public health services. The community is offended by some of the forestepping efforts that the organization has made to combat the deficiencies of already established local programs. Public expectations. The expectation that the community of Brookfield has on our organization will greatly affect the programs, policies, and influence that will drive our organization's strategic planning. It promotes a positive image for Healthy Community Brookfield, but mostly people are confused about the mission and vision of the organization. The environmental and ecological forces. Different seasons of the year are components to understanding disease and wellness within the communities. Certain diseases are more prevalent during specific times of the year and can be weather-based. It is important to understand the influence that ecological forces have on the community members of Brookfield. So, to combat this, we used a SWOT analysis. It is defined by the strengths. So strengths at Healthy Community Brookfield are there are dedicated staff to the mission and values of Healthy Community Brookfield. There's a perceived good by the community, new experienced leadership and recent financial stabilization. Many of the employees are happy to be a part of Healthy Community Brookfield. The Healthy Community Brookfield comprises a diverse array of experience and knowledge, and the programs that are offered by Healthy Community Brookfield are diverse. The weaknesses are strained community relationships within the Brookfield County. The mission and values have not been clear to Brookfield, and many don't know who we are or what we do. We need to acquire accreditation to maintain partnerships and funding, and no program data collection or evaluation of current programs are in place. Many of the programs duplicate community efforts that are already established. For Healthy Community Brookfield to ensure successful program planning and to make a difference in the community of Brookfield, reevaluation of strategy by the understanding of internal and external factors and how to facilitate them will be the key. It is important that the recognition of opportunities and weaknesses within the program are internal factors and can be controlled by Healthy Community Brookfield. With response to strategies and foundations, proper assessment of the needs and the appropriate interventions will be established and will create a groundwork for change. So, SWOT continued. So the opportunities are obtaining accreditation from Public Health Department sponsored programs, to partner and reevaluate needs and programs within community relationships, to continue to allocate more stable funding for programs and services, mobilize community leaders in creating Brookfield-focused initiatives, and to obtain and gather data from programs in Brookfield. Threats are possible funding loss due to not meeting the Public Health Department standards, possible loss of jobs due to fluctuating funding for programs, ineffective programs due to lack of reassessment and data collection. Local leadership is frustrated with the program demands for funds. Economic instability in the United States with public health funding restrictions. And community leadership unwilling to reestablish and repair broken relationships. So, the 5-year strategic plan goals are striving to accomplish mission and vision statements, sustaining collaborative community relationships, the engagement of need-based community initiatives and programs, development and maintenance of data collection systems, the procurement of continuous funding, employee attainment of sense of mission and purpose within Healthy Community Brookfield, and the establishment of community-based awareness of Healthy Community Brookfield. The strategic plan objectives. Objective 1, reestablish stability within Healthy Community Brookfield. Objective 2, establish data collection and management process. Objective 3, create sustainable programs that meet community needs. The goals and objectives and action steps are to be categorized in a hierarchy that are displayed for Healthy Community Brookfield in this pyramid. Healthy Community Brookfield mission and vision statements. These are the current ones that are in place. The mission is, as a non-for-profit organization, Healthy Community Brookfield strives to improve the community's health by strengthening the quality and performance of health promotion and wellness practices through outreach, provision of services, and ongoing education. The vision is, as a non-for-profit organization, Healthy Community Brookfield promotes healthy practices which can lead to improved health behaviors, healthier individuals, and healthier communities. I would like to revise the mission and the vision for Healthy Community Brookfield. So the revised mission for Healthy Community Brookfield includes to create sustainable and impactful collaborative relationships within and for the community of Brookfield, promoting health and wellness. The revised vision is for all people of Brookfield to be healthy and free of diseases. Okay, so proposition, strategic planning, action steps. There are many opportunities for quality improvement among this organization. There's a lack of understanding within collaborating county programs and within the people of Brookfield as to what exactly this organization's mission is. There's a lack of performance oversight and assessment. It is important that if Healthy Community Brookfield collaboratively decides that they meet the program standards for receiving such funding, with any program that is initiated within the community, there needs to be consistent reassessment of programs, goals, target audiences, and impact. Consider partnerships within larger governmental organizations such as the CDC with strategic programs to assist public health organizations such as the Winnable Battles Initiative. This Winnable Battles program is a public health initiative to establish and create collaboration between the government and organizations in partnering to accomplish health goals. The County Health Department is asked by Healthy Community Brookfield to do a Plan, Do, Check, Act quality improvement initiative to determine program goals and their relationship to the needs of the community on improving health and wellness. This quality improvement initiative is a strategic continual approach that seeks to determine measurable success of program implementation efforts. Upon utilization of quality improvement processes such as MAP, Plan, Do, Check, Act, program efforts will align to community-based goals with the Healthy People 2020 objectives and success. Through the MAP framework, there are 6 different phases to assist Healthy Community Brookfield. Now for expanding the budget. So expense budget. Determining a budget plan will guide Healthy Community Brookfield in making the best financial decisions for the people we serve and employees. There will be quarterly evaluation that will be conducted to determine financial state beginning and ending in the October fiscal year. There will be a fixed and variable budget. Factors that will impact budgeting include employee payroll and professional development, grants received and contracts with local and federal agencies allocating funds, physical space expenses and office supplies, each program with specific budget consultants, quality improvement experts, finance experts, medical supplies and educational supplies, contingency expenses for unanticipated costs. The previous budget of $2 million was completely depleted after 8 years, which equals $250,000 per year, an allocation of $62,050 quarterly of funds. Quarterly budgeting needs versus a positive and negative variance will be based upon needs of staffing and program funding. Again, we will use the fiscal year budget and the current financial situation, grants, local public health funding, and establishing corrective actions for under-budgeting and lack of funding and overuse of resources. Thank you very much.